Our media this past few months has not been full of stories of foreign nationals in the NHS refusing to work because it's dangerous, it puts their lives at risk. No, quite the opposite. What we have seen is row after row of pictures of NHS workers, many of them foreign nationals, who have lost their lives to this virus. We've seen their names, we've read their stories. We've read about people like the 57-year-old healthcare assistant who died on April the 14th, the same day as a 51-year-old dental nurse who had trained in the Philippines before coming to Swansea, both of them on visas. Earlier this summer, through the advocacy organisation Every Doctor, I also met someone who'd been working on the front line of this pandemic, a specialist in emergency medicine. He's lost colleagues and knows the daily strain of fighting to keep alive those people struggling to combat the virus, while never being completely sure if he has been infected himself. He is a migrant. He has been working on the front line and paying tax and national insurance to the Exchequer, working for us, contributing. But he will, in time, have to apply for a fresh visa and pay for it, £700. One reason I find that difficult to accept is that I have been so immensely proud of the way that our communities emerged on their doorsteps every Thursday to applaud those working in our health and care sectors. I'm sure most, if not all of us in this place took part. It was spontaneous, it was heartfelt, and it was moving. But was it enough? And will it be enough if we have to suffer this winter when, if as is widely predicted, the virus returns? I think we all know the answer to that is no, it's not. There has to be more, and that has to be down to us in this place. Our government has not yet done enough, either for those born and brought up in this country, or for those who have come here to work. For all those working in our NHS for the past year, there must surely be more recognition and thanks for putting themselves in harm's way. This virus has not discriminated in who it attacks. We are all vulnerable, our Black, Asian and ethnic minorities more than any other community. But what we are doing surely could be seen as discriminating in how we thank those who defend us. It is time we recognise properly the contributions that have been made. The government, to be fair, has to some extent acknowledged this with its one-year visa extension for around 3,000 health and care staff, with visas due to expire before the 1st of October. The 1st of October. But why just 3,000? Why just for a year? Why not everyone? Why not indefinitely? And why are those doing vital frontline jobs excluded? What about the porters, cleaners, and social care workers? Tell me where we would be without them just now. But the biggest blow of all, I believe, is that even those who are included will be forced to renew their visas next year and still have to pay that £700 each or leave the country. We could lose them. People who have lived, trained and contributed to the well-being of this country have helped to save lives and may help to save some of ours one day. I believe that the UK should say loudly and unequivocally that those who have put their lives at risk for our country are welcome to live here. There is a precedent. We have done it before. The idea that anyone who has worked so hard to save lives during this emergency, put themselves at risk, might one day be forced to leave should be unthinkable. And have we asked ourselves, what will happen to the standard of care in this country if they're forced to leave? Where will we find the staff we need? The doctors, nurses, porters, care home workers, if another wave hits and thousands of our valuable workforce have been forced to leave because we did not have the foresight, the compassion to help them to stay. This country, all of us, will be the losers. Our colleagues, our friends, our family. That is why the Liberal Democrats and other parties are fighting to give all existing health and care staff from other countries the right to stay in the UK with their families. And that is why I am introducing this private members bill to grant them and their families the right to settle here without the costs or the bureaucratic hurdles that usually involves. I also believe that it is a view widely held in this House, that it has the support of MPs from other parties. Indeed, the government has indicated with the steps that it has taken so far that it also recognises that the contribution has been made by so many migrants. So I would appeal to them to go that step further and support this move. Send out a message that we recognise, value and appreciate the work that so many people have done for all of us in this. It would be a small way to recognise and celebrate the enormous contributions that people from all over the world make to our National Health Service and to our society, our economy and the well-being of our communities, and potentially each and every one of us.
I've not been given any indication that there is any opposition, so may I put the question? That the question is that the honourable member have leave to bring in the bill. As many as are of that opinion say aye. To the contrary, no. I think the ayes have it. The ayes have it. Who will prepare and bring in the bill?
Sir Edward Davey, Wendy Chamberlain, Sarah Olney, Munira Wilson, Jamie Stone, Alistair Carmichael, Caroline Lucas, Virendra Sharma, Jim Shannon, Liz Saville-Roberts, Belle Ribeiro-Addy, and myself.
Christine Jardine.
Immigration, Health and Social Care Staff Bill.
Second reading what day?
Friday, October 30th.
Friday, October the 30th. Thank you.
Okay, so this healthcare bill has been passed to see that migrants have a free visa and possibly an indefinite leave to remain in the UK, even while we'll fight through all what to do, giving our best to the healthcare system and to the NHS and to the country. And we do know there are a lot of bills and petitions going on for indefinite leave to remain for healthcare workers. Hopefully this bill being read, it's going to be passed to law. Let's share our thoughts in the comment section and let's have a discussion. If you like this video, give it a like, share, thumbs up and subscribe. See you in my next one.